Today we're going to talk about the aesthetic correction of the prominent eye. And this occurs for a variety of reasons. It can occur due to thyroid eye disease, which makes people's eyes bulge out. And it can also occur when people are born with just relatively prominent eyes, but for some reason their eyes lids are pulled down, whether it's due to surgery or whether their cheekbones are just very, very small and they appear to have prominent eyes. Today we're going to kind of focus upon those people who do not have a disease. They do not have thyroid eye disease, but we're going to focus upon whether that condition is due to just the way they were born or whether that was due to a surgical modification. Prominent eyes, as I said, can occur for a variety of reasons, but for many patients it can really be bothersome and cause a host of dry eye and painful conditions, and even not even being able to sleep at night because their eyes are so dry and so wide open. And there are many ways in trying to fix this problem, but we're going to talk about a unique way of actually moving the eye back a little bit, which allows the eyelid to come up and makes the eye much less prominent in a very safe, easy to do procedure. When evaluating someone with prominent eyes, the first thing we want to think of is there any scarring? The second thing is to think about paralysis, whether there's been any nerve injury or whether there's been any problems that cause the eyelid not to blink. And then finally, is there laxity? Each of these can contribute to the problem, but we also want to treat the underlying issue, which is the prominent eye. And treating all of these together, even very small, can lead to a very synergistic improvement for the patient. This is an example of a skull that just shows the nerves and the various deep muscles that are involved. And we can add over top of it the muscle that helps to close the eyelid and the cheek. And you can see in this case, we see a very normal appearing eye that is not prominent, and the eyelid is in very normal position. Our question is, how does prominent eyes then influence the aesthetic and the function of the eyes? In the next circumstance, we see a depiction of someone with prominent eyes. And already you can see how much more prominent the eye is and hangs over top of the muscle and the cheek tissue. This is in stark contrast to the other circumstance where the eye is much deeper into the bony orbit and is protected by the muscle. Comparing them side by side, it's very easy to see how the prominent eye just looks like it'll be more exposed to the air, and how it's harder for the lower eyelid and the upper eyelid to protect the corneal surface. One of the most important things is defining prominent eyes. And we do that based upon the eye's position relative to the bony midface. Because certain ethnicities are born with a very small bone in the midface or in the cheek, and that contributes to their eyes being prominent and their lower eyelids hanging down and potentially showing some white under the eyes. This can be then further exacerbated and made worse with any type of surgery or paralysis. There is something we call a positive vector, and that's shown here in this slide, where the eyes are relatively deep set. So the eye, compared to the cheekbone, is very deep. These patients are almost never at a risk for having eyelid retraction except under the most unusual circumstances. The next is a neutral vector, which is pretty much a normal position. It's where the eye and the bone are almost in line, and under these circumstances it's very unusual to have any issues with eyelid retraction unless there is dramatic surgery or trauma involved. The worrisome case is the negative vector, and that's where we spend most of our time. Patients who are born with either relatively prominent eyes or relatively small cheekbone and midface. These patients are almost always a setup for having problems with lower eyelid retraction and further prominence, especially as they get older or with surgery. Eye prominence actually tends to worsen with age. As we age, the bone of our cheek gets smaller and it rotates outward. This is an unusual circumstance for bones, but it does occur in the cheekbone specifically, and that's been shown by a variety of studies. In these slides, it shows how it affects the eyelid and how it can cause even further eye prominence as we age. But improving eye prominence really comes down to two sets of variables. One is moving the eye back or moving the cheek forward. This gives a better foundation for the eyelid and helps to support it. It's all about giving a foundation to the eyelid so that it doesn't hang down and doesn't hang off of the cheek and thus exposing the white of the eye. I've augmented the midface and the cheekbone in a variety of ways. One non-surgical way is to use Restylane or some type of filler to give just a little bit of an improvement into the cheekbone area that'll give a much softer cheek, much more youthful contour, but also can help to reduce the retraction. Surgical methods are also available and can involve cheek implants, and all these things might be possible and might be indicated. One area which we do exclusively is to move the eye back by removing the eye prominence, by moving the eye itself back, which is actually much easier to do than all the other cheek implants or the other manipulations. It can actually be done in less than an hour and involves often just removal of fat under either monitored or under general anesthesia. But either way, you can come in and go home the same day. And we'll show a few examples of how this can be achieved. One of the critical concepts to remember is that moving the eye back allows the eyelid to come up. In fact, we've mapped this such that we know that the eyelid, for every 2 millimeters to 3 millimeters that we move the eye back, it'll come up 1 to 1.5 millimeters. That can dramatically improve the eyelid retraction in a very simple technique. This particular patient shows a very prominent negative vector. This is due to a condition called thyroid eye disease, where we've learned most of these techniques and we do them much more aggressively. And you can see that after surgery how much of an improvement there is with the eye prominence. And this surgery, while it's much more aggressive than we do for patients without the disease, was still done in an hour and a half, and the patient came in and went home the same day. One of the best ways to improve eye prominence is to remove a little bit of bone or fat from behind the eye and allowing the eye to come back. In addition, the area underneath the eye, called the basin, can also be shaved down a little bit through an incision inside the eyelid, and this allows the eye to settle down into place and allows the lower eyelid to rise up. This is a very effective technique for improving this condition. In conditions such as thyroid eye disease, we use this paradigm all the time, and it works exceptionally well. These couple patients demonstrate that through very small incision under monitored or general anesthesia in a procedure lasting less than an hour, you can achieve very significant results and improvement of the eyelid retraction and the eye prominence. So the question was and is, how can we do this in patients who don't have disease? Well, it actually is a much easier surgery because there's very little scarring involved in these tissues, and it's much easier to obtain the fat, almost the same as you would for a blepharoplasty, and to move the eye down just a little bit. In fact, these series of cosmetic patients have been some of our most extraordinarily happy patients because they have had problem that no one else could seemingly fix, but after this surgery, many of them could close their eyes for the first time and slept soundly for the first time. Many of these patients have had cosmetic or other types of surgery which made this necessary, but they achieve a very significant and extraordinary result through a relatively small procedure. None of these patients actually had other eyelid surgery, but it is possible to do other eyelid surgery such as cheek lifting or even cheek implants, which I've often done at the same time. It all depends on how big the problem is, but we define it for each person. But moving the eye back gives us an extraordinary amount of flexibility for making this improvement.